Thank you all for joining. We are really excited that we have opened up our pharmacy here in the state of Tennessee and thrilled that we're able to now offer this service to patients and clinicians across the entire state of Tennessee. Our program has shown to be very effective in impacting outcomes for patients who are in medicated assisted treatment, including improving retention rates, helping remove barriers due to transportation issues, reducing relapse rates, and just reducing the stigma that a lot of patients face when going to get their medications filled in a traditional setting. We have three guests with us today that we're excited to have with us. We have Dr. Victor Wu, who's the Chief Medical Officer at TennCare, and is going to talk a little bit about improving access to quality medication-assisted treatment across the state of Tennessee. We have Andy Grant, who's our pharmacist-in-charge. Here, we'll bring in a minute to talk a little bit about our program. And then Dr. Richard Sherman, who is a physician and owner of Compassionate Recovery Care, who started our program earlier this year. And we'll talk a little bit about how the program works in his office and the impact he's seen with his patients. So with that, let's get started. Up first, we had asked Dr. Wu from TennCare to join us today to talk a little bit about medication access to treatment across the state of Tennessee. So thank you very much, Dr. Wu, for joining us today. Can you tell us a little bit about your background and your role at TennCare?
Sure, Bob. Thanks to you and Cordant for doing this and for having me. Appreciate the opportunity to get anytime I can talk about TennCare and how we can offer more support to our members, but also to hear from the community on how we can improve is something that I very much cherish. And so just in terms of my background, I'm an internist by training. I was actually just talking to Dr. Sherman. I still practice as a hospitalist, but kind of have did all my training in Atlanta and practice there in the urban setting at Grady Hospital, and have just always been impressed and kind of burdened by how challenging it is for several of our members in how complex they have to navigate their social needs, their health environment, their professional environment, all the different challenges that they face. And certainly in the addiction world, I think that's an area where you see that play out in such a complicated way. And so kind of for me, having the opportunity to come and be part of TennCare and to think about the types of work, including around the opioid epidemic and also substance use disorder, it's kind of some of the things that have been near and dear to my heart from training, as well as kind of my personal journey to this role.
Great. Thank you. That's really helpful. I know TennCare has done a lot in the MAT space over the last 4 or 5 years. Can you tell us a little bit about what TennCare is doing now to ensure access to quality MAT care?
Yeah. We definitely have put a lot of time and energy into it, and certainly we're not all the way there yet. I wish, this is going to be a multi-year process, but I hope that some of the things that we've done have really kind of begun to feel like they're in support of the community. I think we've had some good feedback and also had opportunities to make some course corrections. But really, from our perspective, we've looked at it truly from a public health lens. This was an epidemic. It was a challenge to think about opioid addiction from across so many different layers of the population and the health impact that it had. So from a primary prevention, we really begin to try to right size and reduce overexposure for members, for first-time opioid users, and try to work on those types of things in terms of reducing overexposure. From a secondary prevention, kind of for those that we already know have been on opioids, we've been really trying to increase our outreach to those members. How do we begin to get them connected to primary health care, primary care, behavioral health care, even before they might become dependent or addicted to care? And so we've had some really good success in integrating with our data and our MCOs to really begin doing outreach to get those members connected to care. The benefits they already have, they just may not know how to use them or have the access to those. So we've really done a lot of work there to try to bolster our primary care and our mental health to really be able to target some of the opioid addiction or risk for opioid addiction. But really the last space maybe today what's most relevant is what we've done in that kind of tertiary prevention space, which is really to focus on how do we increase access to MAT. We know that MAT is an evidence-based treatment that people who are on MAT often do much better and stay in recovery for longer. We think it's important for all of our members to have access if it is the right choice for them to be on MAT and to get high quality MAT. So over the last few years, we've really been building out a network to think of it really as a specialty. It isn't just something that gets kind of done. You really need to be dedicated to MAT. You need to have a specialty network of those who are highly trained in the work, whether through fellowships or through just day-to-day practice and learning how to treat this group of patients. We need to make sure we can track those members and ensure that they get the supports and transportation and the other social needs met and care coordination efforts around that front. And we need to make sure that the pharmacy benefit really helps meet their needs as quickly and as effectively as possible. One of the analogies that we've at TennCare have spent a lot of time thinking about is we oftentimes, talk about TennCare as being a safety net, in that our safety net providers catch our members. But I don't think in the addiction space that's enough. It's a little bit hokey, but we really think of it, how can we make our safety net more like a safety trampoline, so that if someone falls down or has a relapse, it can't just catch them. It's got to throw them right back into that recovery space. And how do we get them back on their feet and back into MAT treatment if they've relapsed, or back into their a more social, stable environment. And we've been trying to think about ways to shore that up, and having a network of providers that have stepped up to say, we want to do the right thing. We want to care for these members in a comprehensive way, knowing that we can refer members to that network and then work with those providers, and having partnerships around data, around quality metrics, around better streamlined pharmacy benefits is really essential for us, so that we can develop a partnership and make that safety net kind of be more of a catapult back into the recovery space.
I like that, the safety trampoline. That's a good term. And I think you just expressed really well how complicated the issue is, right? And having doctors trained to do MAT is one thing, but then there's a lot of other facets to getting the patient there, and all the other things and comorbidities that are impacting that patient's care.
Yeah.
So it's just a lot of angles to come out of that. What are some of the common barriers to MAT treatment that you see in the state?
Yeah, I mean, I could go on for a long time. I'll highlight a couple, as I was thinking about this recently. I still think stigma is real. And unfortunately, that is something that we need to continue to find ways to fight against, not only from a patient level, but even from a provider level. How sometimes, it may actually be more kind of the complexity of these members makes it hard to feel like you can engage with and treat them. And I think the pharmacy space, there's still stigma too. How do pharmacies and pharmacists support and be part of that network? And I think the work that Cordant is doing is highlighting that issue for us at TennCare, and something that we're continuing to look at how to improve. And a couple other ones I would just mention, certainly transportation and access continues to be an area where we want to improve on and support. If you can't get to your appointment, or you're not able to get to the pharmacy, then that's just another kind of systemic challenge that might trip you up and cause you to not stay in recovery, even though you have the desire and the will to do that. And then the last one I might mention for folks on this call to think about a lot is, we absolutely know that addiction recovery care is in and itself something you have to address full-heartedly. But in order to really move the needle, you also have to have integrated addiction care with primary care and behavioral health care and all the other services and medical needs there. And I think there's an opportunity still in our healthcare ecosystem to where the patient remains connected to all those services. It can't just be addiction care. It can't just be their primary care provider. How do we actually integrate those services so that the whole person healthcare that we all talk about and all try to accomplish actually gets developed, whether that's in co-located services, or whether that's through care coordination back to the primary care provider, or whether that's in peer recovery supports, or helping that person navigate to the next level of care. These are all things we need to keep moving on. It's not one size fits all, but we need to keep keeping the pressure on integrating primary care with mental health care, with the addiction care all together, so that our members can get all the comprehensive needs that they can met over time. So those are some of the barriers I still see and hear about, and there's others, of course, but those are some of the ones I wanted to highlight today.
No, well said. And that, the integration of primary care and mental health care is not just a Tennessee problem, right? I mean, that is something that nationally that we still struggle with as a healthcare delivery system. How do you see the pandemic affecting treatment and access over the last 6 or 8 months?
Yeah, I mean, I think certainly there's been challenges that you could all expect. The disruption of much of the healthcare industry in terms of social distancing, masking, and having some increased barriers to access have made it tough for many of our new patients to get appointments or to find individuals. And so some of those things, we're tackling. I think from the pharmacy side, we hear, either folks not being able to get to the pharmacy consistently, or pharmacies that are running out of supplies, or pharmacies that are not willing to treat some of these patients and fill their full supply. And I think that's an area that we think there's a lot of need to improve and support efforts to improve that. On the other hand, I might highlight that, some silver linings I think have come out of this in a really positive way. In the face of a crisis, you kind of have to innovate, stay alive. And some of our practices have been really, really creative. And we're so grateful for the work that they're doing. And we've heard about implementing tele-MAT almost overnight in a lot of different places. That was somewhere that I think for the state of Tennessee, we as a whole, not just in TennCare, but as a whole, had not really had a kind of a consistent tele-MAT approach or really some of the authority there. And I think the opportunity to overnight increase telehealth to serve these members has really reduced some of the challenges for those members. And I think that's fantastic and something we're looking at figuring out how to continue. Same thing with group counseling sessions. I remember one of the practices I spoke to recently told me that, prior to the pandemic, their group counseling sessions might have 30% attendance rate. But the moment they switched to Zoom group counseling, like 99% of people were showing up. It was easier for them to dial in. They actually had better and more engaged conversations in those group counseling sessions. People were willing to sit in their home and actually get on the phone and talk about their issues as opposed to coming to the office and talking about those issues. So that was a really encouraging and kind of aha thing that we had not thought about necessarily. And so having that technology do that has really been helpful too. So those are some examples, I think that have affected, but also on a positive side as well. And we're looking at other areas. We've been trying to incorporate on-demand rideshare into our transportation arsenal, and we've had some really great progress with Lyft in supporting some of the addiction recovery. I think, Bob, what you're doing at Cordant, how you bring the medications to the front line so that there's not a separate trip that's required, is another area that we think has got promise to it. And so we continue to look for opportunities to innovate and to improve. The pandemic just throws up some new challenges, but we'll be persistent and we'll continue to look for opportunities to try to increase kind of that consistency of care for our members. And we're open to suggestions always. And I think this is a good example of how we're interested in learning from the community about what works, what doesn't work, and any suggestions you all have. So just wanted to make sure to say that as well.
That's fantastic. I mean, I think when we talk about the pandemic and how it affects recovery and treatment in general, it's easy to focus on, well, we've seen overdoses go up, right? We've seen some people fall out of treatment. But you mentioned so many of the positives there that are going to be long lasting, and the use of telehealth and integrating that into, on-site visits as well, and how that impacts group, all the things you mentioned. I had a provider the other day tell us about how doing the group Zoom calls helped to give an insight into what that patient's home life is like. And that they could see things that were happening in that patient's home life that they could potentially address that otherwise they would never have been able to see in the past. And there are so many positive things that will come out of this. So.
Yeah, absolutely. I mean, I think the last thing I'll just say kind of in reaction to that, I agree. We are certainly concerned about some of the numbers. You mentioned the overdose rates, and we've also seen kind of a little bit of flatlining of some of our more consistent members who access treatment. And so we worry that they may be dropping out. And we've also seen some increase in the neonatal absence syndrome rates compared to, for the last 3 years, we've seen a real decrease, but those numbers are starting to go up a little bit as well in the wrong direction. And so I think that's just a continued call to action that in this period of risk for social isolation and social distancing, which actually has physical isolation impacts, an addiction, oftentimes, disease of loneliness will continue to increase. How do we as a community, how do we as TennCare, as providers, how do we as in our MCOs kind of band together and make sure we're wrapping as much support around that member as possible? So I would just encourage any of the providers out there, all of our MCOs do have dedicated behavioral health and care coordination teams on MAT and opioid use disorder. We've really been building out that capability. And I'd love to make sure that the provider groups have direct connections to our plans so that they can offer those supports. If they don't have care coordination, our plans can come in with care coordination. If you don't have better transportation services, how can we get the plans to support your members in those needs? And that is a really important partnership that we need. And that's something that we've been trying to work on building out with the MAT network. Without knowing the providers, we couldn't set up that partnership. And now that we know much better who our MAT providers are, we really want our MCOs to be a partner with you in this. And so to the extent that we can support those kind of connections and support that accountability, please make sure to reach out to me or reach out to your MCO representatives, because they are eager to support, especially in this time with COVID, as things become even more isolating for our members at home. Fantastic.
And I'll say, when we came to the state of Tennessee and we engaged with TennCare about a year ago about this program, what Dr. Wu says about just the engagement of the MCOs, the engagement of the TennCare team really has been fantastic. And this is something that's very important to them, obviously, based on their actions. And it's been great to have that support. So thank you, Dr. Wu, for everything you're doing. I know you're very busy, and we'll let you get back to your busy day. Obviously, you can stay on and listen to the rest if you can. But thank you very much for your support, and thank you very much for your time today.
Yeah, thanks for the opportunity to chat.
One of the things that Dr. Wu mentioned there was telehealth. And, whether you're seeing patients in your clinic or you're doing telehealth, our program can be implemented. We're going to briefly go through the program at a high level and show you how it works. And Andy will step in a minute and talk a little bit about it more in detail. I'll talk at a very high level. But no matter how you're operating today, it can be implemented. What's important to note is that our program was developed based on feedback from patients and clinicians across the country. We heard consistent feedback about the stigma, judgment, lack of privacy that patients were facing, the transportation barriers that patients often face, and some simple things like pharmacies not carrying the medication that they need for the MAT treatment. We recently conducted a survey of over 800 patients in our program, and overwhelmingly patients told us how satisfied they were with the program, how much easier it made things for them, and most importantly, how much it kept them on track with treatment and more adherent to their treatment programs. Most importantly, though, the study we conducted over the last couple of years, comparing a group of patients in our program to a cohort of patients who are not in our program, showed that patients in our program were 52% more likely to stay in treatment, especially early on in treatment. We saw a 46% decrease in relapse events and 42% fewer drug-related ER visits for patients who are in our program. Our program is really simple. If you are seeing patients in your office, we simply coordinate the delivery of the patient's medications to the office when they're there. And if you're doing telehealth, we have home delivery to coordinate to the patients, deliver to the medications on time in a stigma-free way. There are two really keys to our program. First, Cordant, for those of you who are seeing patients in clinic, will provide what's called a pharmacy coordinator, or a PC, for our program that is on site, that's an employee of Cordant. Part of our program, what makes our program work and compliant with all state and federal laws, is that we have to manage the medication through the entire process of delivery. And we do that by putting a person on site to manage those deliveries. The second thing is clinics who utilize our service are able to use one pharmacy, primarily Cordant, for the vast majority of their patients, which helps with workflow, helps streamline things. Our program is an opt-in program, so patients have a choice to use our program or not. They always have the option to use another pharmacy. But what we found is when they're given the option to utilize our services, the vast majority of patients will want to use them because it just makes life easier for them. Now, I'd like to introduce our pharmacist in charge, Andy Grant. I'm going to mask up here, so Andy's going to join me close. Andy has over 20 years of experience as a pharmacist, and he's done just a phenomenal job jumping in here and taking charge here in our Tennessee pharmacy as we open. So, Andy, why don't you tell us a little bit about your experience at the pharmacy so far?
Yeah, good afternoon. I'm Andy Grant. I'm the Cordant Pharmacy here in Tennessee. I've got 20 years of experience both in the retail environment as well as institutional-based pharmacies. I know the hardships our patients have faced at other pharmacies, how they feel shamed or judgment when they walk into those facilities. Cordant has created a wonderful environment in which we remove all that. We've created essentially a proper treatment niche for our clientele. Abuse addiction therapy is just that, it's a disease. It is not a character flaw. We aspire to treat our patients much the same way we would treat a diabetic walking into the pharmacy. That is, with respect and integrity. I'm looking forward to supporting both your staff and yourself in helping managing and treating these patients, and hopefully a successful outcome for all involved.
Great. Why don't you tell us a little bit about how the program works?
Yeah, sure. First, the prescription is e-prescribed or otherwise sent directly to us here at the pharmacy. One advantage to that, there's no lost or misplaced prescriptions on the patient side. Our pharmacy team will review the prescription, check the last appropriate fill date. We also check the state's controlled substance database, and we review all laboratory drug testing if there are any. If we discover any irregularities, either myself or one of my team members will reach out to the office or the clinician directly and just seek your counsel on the appropriate next step for the patient. We also offer naloxone therapy here and prescription drug take-back program to all our patients. With coordinating the prescription delivery with our on-site PC, we're trying to manage that portion so it coincides directly with your patient's office visit. Once the patient is finished with the appointment with you, they simply walk next door into the next room over to meet with our PC. There they will receive their medication. They're also given the opportunity to speak directly with myself. If they have any questions or if they're receiving a new prescription, we can review that with them at that time. The medication is delivered in a white sealed bag, just like it would be at any other pharmacy. And essentially, that's all there is to the program.
Yeah, it really is. Having seen it in action so many times, it really is pretty simple
Yep.
in terms of how we execute on that, and how your team executes on it. I know we're particularly proud of the naloxone program. We've been able to distribute a lot of naloxone, life-saving naloxone, to patients across the country, and we'll be doing that here in Tennessee as well. So the patient no longer has to make another trip to the pharmacy to get their prescription. They can go home, go back to work, get back to their family, whatever the case may be. To be clear, we are not putting a pharmacy on site, right? All the pharmacy work happens here with Andy and his team, as far as the dispensing and all of those type of things. We're simply coordinating the delivery of the medication to the patient at the time of their office visit or to their home in a stigma-free way. Your office will never, and office staff will never touch the medication, never manage the medication. In fact, they're not allowed to. Nothing ever stays overnight. So if a patient has no shows, or there's a dosage change or something like that, that we take that medication with us when we leave that day. We're in network with many insurances, including TennCare, and there's no additional cost for the patient or the practice to utilize this service. Normal copays and things like that apply, with just like any other retail pharmacy. And we offer low competitive cash prices too for those that are paying out of pocket. So thank you very much, Andy. I appreciate it. And we'll have you come back in when we start taking questions here in a second.
Thank you.
All right, now I'd like to introduce Dr. Sherman. Dr. Roger Sherman. First off, doctor, I have to say, like, your hair is a little different than what the picture we got from you. So it's a false advertising there.
I'm sorry. It's kind of fallen out with the whole COVID thing. So.
Well, I'm a little jealous. I wish I'd gone that route too. That's a nice, simple way to take care of the problem. But thanks for joining us today. Can you tell us a little bit about your background and how you got into addiction treatment?
Yes, sir. So my name's Roger Sherman. I'm a physician here in Nashville. I'm board trained as an OB/GYN. My initial experience with addiction, unfortunately, was with my ex-wife, who became addicted to pain medication as a result of well-meaning physicians who were treating her chronic illness at the time. And I personally saw the effect opioids had upon her, my children, and myself. And this is a horrible disease for anyone who's never experienced it firsthand. Fast forward to 2016, I was about 16 years into my practice and was becoming pretty severely burned out in OB/GYN. I was treating a number of my pregnant ladies who were having problems with addiction. And I was using Subutex to treat these ladies, and having impressive results, as I think many of us have seen. These patients were getting their lives back, and it was very motivating as delivering a baby or helping someone with their GYN problems. In 2018, I elected to go ahead and close my OB/GYN practice completely and began treating only patients with addiction, both males and females. And at this point, I see addiction or successful treatment of addiction as being really important, because it has really far-reaching impacts upon the lives of patients, their family members, and bringing down overall healthcare costs if it's successfully treated. And I see what Cordant is doing as being a big way of helping to achieve success with these patients.
Right. Yeah. The story about your ex-wife, I mean, that's so common. I feel like nowadays everybody has that story, right, of the person they know in their family that's been impacted by this epidemic. When stay-at-home orders were issued in the state of Tennessee, we saw several clinics sort of shut down initially. You really were ahead of the curve there and had telehealth up and running very quickly before even all the stay-at-home orders were in place. Can you tell us a little bit about what prompted you to make that decision and to move to telehealth?
Yeah, so there were several things, but basically I've been taking TennCare since 2016. I saw a big need amongst the TennCare community to go ahead and help these patients, whereas the majority of clinics in Tennessee were cash. I was actually, or at least in Central Tennessee, one of 2 clinics that I'm aware of that was taking TennCare at the time. And when when payment parity occurred and they were paying for telemedicine visits at the same rates as the TennCare visits, I elected to go ahead and begin seeing part-time, patients via telemedicine. These were select patients who were reliable, attending all their visits, and had some good history with me to begin with. So I began offering Zoom visits to them. I found that patients really appreciated the ability to do this, so they didn't have to travel in to see me. I would do pill counts at those visits and also have them see their counselors at the same time. They would still have at least one visit a month with me in person at that point. I found also that the increased frequency of video visits helped with patient accountability, and it helped decrease relapse frequency among my patients. And once again, patients really appreciated that. Currently, after seeing the results of offering this telemedicine, I feel that compliance is greatly increased, fewer no-shows, and I've come to believe that we have to meet our patients where they're at. And Cordant is a big part of doing that. So not just physically, but kind of emotionally, or where they're at with their disease. Now, since COVID-19 has upended all of our lives, telemedicine has taken on a much greater importance in protecting patients and ourselves from the virus. Prior to March 16th, you had to go ahead and prescribe the medication at an in-person visit, or at least they said you had to at least have had one visit where you could go ahead and do an examination with the patient. That was according to the Ryan-Haight Act. After March 16th, the DEA put out a public health emergency exemption to that. And so now we can go ahead and prescribe during remote telehealth visits also. I think this definitely decreases the risks of illness to ourselves, to our patients. I'm just going to give an example, if I could, real briefly. A patient that I recently was taking care of, and I had to have her come in and see us here at the office. This lady has Hep C, HIV, and diabetes. She comes rolling in the TennCare van, not wearing a mask. Driver's not wearing a mask, and that's a prime chance for her to become quite sick. So I think it's that we're really protecting patients by offering these services and offering Cordant delivery, home delivery for those patients.
Yeah, you mentioned meeting the patients where they are, and I heard you were even meeting some patients out in the parking lot in terms of doing testing, seeing them out there if you needed to.
Yeah, I was doing that, and I still do that. You know, we've got a nice little picnic table across the way. I try to avoid having people come into the office unless I can keep them a distance away and keep everyone masked up. At this point, we are doing urine drug screens in the office. Previously, we would do the under the tongue oral swab, yes, sir, which is nice because Cordant does offer those services also as part of their laboratory division. And so, and I just want to bring up, we have our pharmacy coordinator, and she's also trained to do the urine drug screens. And so that takes the stress off of my staff member to go ahead and observe those urine screens. It just makes it really nice when it comes down to it.
Yeah, that's great. It's great that you were ahead of the curve in terms of the telehealth, seeing the value in that. How have you seen, or have you seen an impact on the patients who've taken advantage of the Cordant pharmacy program?
Absolutely. I will say Cordant initially approached me early on about the pharmacy program, and I felt that it was going to be really beneficial to my patients and that they would appreciate the ability to be able to see me and pick up their medication at the same day, all in one stop. So many of my patients have described going into the pharmacy and feeling stigmatized, having the pharmacist peer over the counter at them, and they've just gone through such a tough, traumatic life, and anything we can do to show them compassion and to make them understand that we care about them, I think is important to their success and their ability to beat this disease. And this was one way of doing it. I mean, the pharmacy coordinator we have, she's awesome with these patients. And she greatly cares about them also. And I think that the patients definitely feel that and appreciate that.
Great, thank you. Yeah, the pharmacy coordinator position within our company, we've developed over the last couple of years, and it really is. I mean, the people who are in that role are really proud of the impact they can make in the delivery service, and they get to hear that patient feedback directly of how much time it saves them and how they're treated with respect. We had one person tell us one time that said, I don't ever get called ma'am anywhere other than when I call your pharmacy or when I see the pharmacy coordinator. And it's great that that gets that experience. So, did you have any concerns when you first started working with Cordant?
Well, my initial concern that was safety. That was my initial concern. If people knew that medication was being dispensed, or not, it's not being dispensed, I shouldn't say, provided to patients out of the office. But my initial concern would be people would kind of target us due to the idea that, hey, they've got medication there. We're going to go in and hold them up or something. And, I will be right. I'll tell you, I have a very safe office. I've got cameras and what have you. So my security is pretty good here. But honestly, I have not had any concerns since I started with Cordant. I don't get the sense that we're being targeted, or that we're going to even have something like that happen at this point. I've been doing this since, I think it's been since January, February. Do you remember? March. Okay, since March of this year. And I can't tell you how happy I've been with it and how comfortable I am with the current setup that we have. And like I said, the big benefit is the benefit to the patients as far as their happiness, their ability to be successful in the program. And it certainly has increased success rates and decreased relapse rates, I can say, in my clinic.
Right. That's fantastic to hear. And thank you, Dr. Sherman. And just for those of you who are listening in and say, well, how did he start in March if you just opened your pharmacy, 60 days ago? We serviced a handful of clients, sort of thought leaders like Dr. Sherman, who wanted to get started early through our Kentucky pharmacy through a non-resident license prior to opening our store here in Tennessee. So, and now Dr. Sherman's patients are serviced out of our store in Tennessee.
Hey, Bob, may I say one other thing that I think is really important about the service that you guys offer? There are pharmacies around, some very large pharmacies, that really give patients a rough time after, TennCare only pays for 6 months of, a full 2 units of medication a day. And after 6 months, the patients, are required, basically have to pay for half of that themselves. Mm-hmm. And the pharmacist, Andy, here in Tennessee, he's awesome. They work with our patients. They don't give them a rough time. They obtain the prior authorizations, and they go ahead and make sure that the patients have a pretty straightforward way of getting their medications. Whereas when they go to other pharmacies, I'm on the phone for hours, dealing with trying to make sure our patients get the treatment they need. And that's not the case with Cordant. So that's all I want to say about that.
No, that's great input. And I will say there are some other great pharmacies out there. And we have some patients who have great relationships with their existing pharmacy. And if that's the case, we'd love for them to stay there. They don't, maybe our service isn't the perfect fit for them. Maybe it can make things easier for them, but if they're in a good situation, that's great. And we appreciate that pharmacist and that pharmacy's work. We do have some doctors who will tell us, their biggest concern when they first start with us is, well, you don't understand my patients. These are addiction patients and they can be difficult and challenging. And we like to say back, those are our patients too. 95% of what we dispense is buprenorphine today. And those are the same patients, and our staff is well trained to be empathetic and understanding of the challenges that they face. So it's great to hear that feedback.